Hi friends, today I will talk about human metapneumovirus. Presently, the epidemic of human metapneumovirus has emerged in China, and there are likely chances that it can spread across various countries. In India, till date, 3 cases have been reported in South India. Let us see how does this spread and what are the signs and symptoms and preventive aspect of HMP virus. First is the disclaimer. Caring Docs YouTube channel does not provide medical advice. Information available on this channel does not offer diagnosis or advice regarding the treatment. Information provided by this channel is for educational purpose only. It should not be used as an alternative to healthcare professionals' diagnosis or treatment of any person or animal. Please seek the help of medical expert for diagnosis, prevention and treatment of medical illnesses. There is no endorsement for any brand or a company. Human metapneumovirus is a respiratory virus. It was first discovered in 2001 in Netherlands. It belongs to Pneumoviridae family. Two genetic lineages have been discovered so far, A1, A2 and B1 and B2. It affects both upper and lower respiratory tracts, so it causes both upper and lower respiratory diseases in people of all ages. The high risk individuals are young children, elderly adults, and people with low or weak immunity. The symptoms of HMPV virus are similar to that of COVID or any other viral infections. Most common symptoms are cough, fever, nasal congestion, shortness of breath, and in severe cases, patient may end up with bronchitis or pneumonia. HMPV virus spread from person to person through close contact, close personal contact such as touching or shaking hands, droplets infection in the form of coughing and sneezing, touching the contaminated surfaces, and then touching the mouth, nose, and eyes. The incubation period is 3 to 6 days. In temperate climates, it begins in winter and lasts through the spring. The Center for Disease Control Surveillance data shows that HMPV is most active during late winter and spring. The preventive methods are similar to that of COVID. Washing hands frequently with soap and water for at least 20 seconds, avoiding touching the eyes, nose, or mouth with unwashed hands, avoiding the close contact with the people who are sick, covering the mouth and nose when coughing or sneezing, cleaning frequently the touched surfaces, staying at home when sick. Diagnosis of HMPV virus is done by nucleic acid amplification test, that CBNAT. It is like RT-PCR, it is more sensitive. The various antigen detected tests are also available, but they are less reliable. These are enzyme immune assays, enzyme linked immune sorbent assays, direct immunofluorescent antibody test. The serology or the antibody test are also there, but they may be utilized during the outbreaks and often require validation with RT-PCR. So RT-PCR is the most sensitive test for diagnosis of HMPV. Coming to the treatment, till date, no specific antiviral treatment or vaccine for HMPV is available. Treatment is the symptomatic treatment only. Patient has to remain hydrated. Rest is very important. We give medicine for pain and other respiratory symptoms, and the people or the patients who develop bronchitis or pneumonia, they may require oxygen support in severe cases. So infection control measures in clinical settings involve isolation practices and discharge practices. Isolation practices include droplet isolation for all adults with respiratory infections, and contact and droplet isolations for infants and young children with respiratory infections. The discharge practices they include controlled RT-PCR on nasopharyngeal swabs, which is usually routinely not recommended. So, concluding the topic, HMPV is a common but underdiagnosed cause of respiratory illnesses. The preventive measures are key to reducing the spread. Increased awareness and testing can help in better management. We should be stay informed and we should share the information to protect our loved ones. I have taken these references from CDC guidelines and data, National Respiratory and Enteric Virus Surveillance Systems. An ounce of prevention is worth a pound of cure. It was said by Benjamin Franklin. With this, I conclude by today's topic. Stay informed. Please spread the information, its preventive aspect, to all your loved ones so that we can stop the menace at a right time. Thank you. Keep learning.